Hello, everyone, and welcome to the TB Education and Training Network webinar, Innovative Approaches for the Virtual Training Environment. This webinar is being recorded and will be posted online, and webinar registrants will receive an email when the recording is available. My name is Carissa Sarah Joseph, and I will be today's facilitator. I am a health communications specialist with the CDC Division of TB Eliminations, Communications, Education, and Behavioral Studies branch. Before we begin, I'll provide a brief overview of the webinar and a few introductory slides. In today's webinar, we will hear from speakers from the TB Centers of Excellence for Training, Education, and Medical Consultation, also known as the TB COEs, on lessons learned and tips for holding virtual trainings. Presentation topics include principles of online learning, training, production, and implementation, facilitator preparation, and learner engagement. All participants are muted during the presentation, but we do encourage you to communicate by using the chat box. We will conclude the webinar with a question and answer session, and throughout the webinar, we will do our best to address questions and comments that were submitted through the webinar registration form. We also encourage you to use the question box in Zoom to submit questions throughout the webinar. In Zoom, we have also attached a modified presentation slides and a list of resources compiled by today's speakers. Our learning objectives for today are, upon completion of this presentation, participants will be able to identify several strategies for creating effective online training opportunities, identify 5 steps to develop an effective virtual training plan based on the ADDIE model, describe several considerations for recruiting and preparing facilitators to support skill building activities in the virtual training environment, and describe factors and strategies that can improve learner engagement for the virtual training environment. Next slide, please. Our speakers for today's session are Ariel Gunn from the Southeastern National TB Center, Delfina Sanchez from the Heartland National TB Center, Anne Raftery and Amelia Alanis from the Curry International TB Center, and Olivia DuPont from the Global TB Institute. The speakers will also share a few interactive elements that showcase and model activities that you might be able to implement in future virtual trainings. Next slide, please. I also want to take a moment to note the following disclaimers: that the findings and conclusions in this presentation are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention, and that use of trade names and commercial sources is for identification only and does not imply endorsement by the U.S. Department of Health and Human Services. So thank you for joining, and I will now pass the virtual mic over to our first speaker.
Awesome, thank you. Next slide, please. As Carissa mentioned, we've all chosen an activity that we'd like to show you, and I selfishly have chosen a focusing activity, a breathing activity, and I'd love for you to follow along. It's square breathing or box breathing. If you prefer to breathe normally, don't make yourself pass out. It's just a nice 60-second breathing activity. So let's go ahead and do it together, and then we'll get started. Awesome, thank you so much. Can we move to the next slide?
An urgent message to anyone with type 2 diabetes or pre-diabetes.
Awesome, thank you. Next slide, please. Awesome, thanks. My name is Ariel, and I'm an instructional designer with SNTC, and I'm excited to talk to you about principles of online learning. Next slide, please. So the topics that I'm going to cover today is I'm going to define a few varieties of online learning. I'm going to highlight some key principles of adult learning and identify strategies for creating an effective online training. And what I hope you'll be able to do is identify several adult learning principles and strategies that you can take back with you and apply in your own context. Next, please. All right, so first things first, what do we mean by online or virtual? We often think of it in stark contrast to face-to-face. So in face-to-face training, we usually think of, usually it's synchronous, and online or virtual is asynchronous. In face-to-face, the content is instructor delivered, whereas in online or virtual, it's technology delivered, maybe through a learning management system or some kind of software. And the learning activities are mediated through, in face-to-face, learning activities are mediated by the instructor and online mediated with technology. But we want to open up the possibility that there's actually a wide variety of modalities when we mean online. Hit next, please. And so we want to present this idea of potentially blended, hybrid, or flipped. These terms are sometimes a little fuzzy and sometimes are used interchangeably. But what we wanted to do is just open up the possibility that there's actually just a huge variety in terms of the kinds of online trainings that you can choose for you and your learners. And so there's really a mixture of synchronicity, location, delivery method, instruction type, and you can definitely customize this for your content and your learner needs. Now, one thing that I'm going to give examples of throughout my presentation is one of SNTC's clinical course, and we've opted to have a flipped remote delivery method. And so what that means is we've taken the lectures and we've flipped them in that learners watch the lectures ahead of time through the learning management system. They watch videos. And then when they come to a live session that we facilitate using Zoom, they come for active learning activities and breakout sessions and discussion. So I'm going to provide some examples of that. Next slide, please. So before we get started, I just want to talk a little bit about adult learning or andragogy. A lot of you may already be familiar with Malcolm Knowles, and he has these 4 principles of adult learning in contrast to learning associated with children. And I'm just going to quickly go through these. So the first is self-concept. Adult learners tend to be very self-directed. And so it's important that they be involved in the planning and evaluation of their instruction. Adult learners also have more experience than younger learners, and it really provides the basis for most of their learning. So it's important that they have opportunities to reflect and connect learning to their own experiences. In terms of readiness to learn, adult learners are most interested in what they need to know. So it's really critical that training is relevant to their roles or lives. And finally, orientation to learning. Adult learners often want to complete a task or solve a problem, or maybe even perform something more efficiently. So it's really important that trainings be task-oriented versus content-centered, and I'll unpack that in just a second. Next slide, please. So the first strategy I want to share with you, I've got 3 strategies. The first one I want to share with you is applying learner-centered design. And what I mean by that is really refocusing from teaching to learning. So what is it that your learners will do to demonstrate that they have mastered a concept or a task? And I'm going to provide some examples of that in a moment. The next suggestion, back please, sorry. The next suggestion, creating relevant assessments that engage learners with the content and really deepen learning. And then finally, providing feedback on learning. Now I'm ready for that next slide. Thank you. So one of the things that we did in our clinical course, we started with kind of traditional objectives for CE, and they were very teacher-centered, and they focused on the content that was covered. And so we actually just renamed them content covered. And then we added some learner-centered objectives. Hit next, please. And so you can see here, we added in the course, and we actually shared this with our learners, that we added learning center objectives, in that this is what learners would actually be doing in their activities. And this is how they would demonstrate their learning. Next slide. So here are some examples about how we really thought about our assessment strategies. Like many of you, we use case-based learning. As I mentioned previously, learners are very task-oriented and they want authentic or relevant activities. So we chose to use a lot of cases for our activities. We also scaffolded our activities. And what I mean by that, on the left-hand side, you can see an outline of one of our lesson plans for a module. And you can see that learners are watching course content. And the first highlighted, it's a little small, but the first highlighted is a module 1 knowledge check. So we had just a really short quiz where learners could check their knowledge. During class, we had instructor-led case modeling, and there was opportunities for Q&A and discussion and feedback. And then we broke them out into small groups for practice using Zoom breakouts. And then after class, we had individual practice with an application activity. And again, we were using cases. And then we wrapped it up with a 1-minute reflection. And that was it. In the instructions, it said take 1 minute and jot down any questions or anything that really resonated with you and that you could take back and apply. And then the final thing that we did is we really built in a lot of feedback. So within the learning management system, there was automatic feedback. Sometimes there were activities where a grader would go in and provide feedback. And during the live session, there was a lot of feedback from our doctors. Next slide, please. So the next strategy I have for you is humanizing the online experience. And the suggestions I have for these are getting to know your learners and their needs, creating strong instructor presence, and providing opportunities to connect. So in the next slide, I'm going to show you some examples. Next, oh, thank you. So these are some activities that we selected to humanize the learning experience. Sometimes folks find that taking an online class can be a little alienating. And so these are some strategies that we've picked up and have learned from other folks. So in order to better understand learner needs, we inquired about their goals during registration, and then we asked again in the first discussion board. So on the right is the discussion board where folks can introduce themselves, and we asked what it is that they really wanted to learn. In order to establish instructor presence, which research has shown has really has a strong correlation to learner satisfaction. We asked our doctors to provide informal welcome videos, and they were kind enough to oblige, and they were just 30 to 60 second, very warm welcomes. You can see they did them in their home, in their kitchen, their home office. And then they also conducted live sessions, and they kept their videos on for that. So learners felt very connected to them. In terms of learner-to-learner connections, we provided, again, as I mentioned, this introduce yourself discussion board, and we also had breakout groups during every session. And we even had a kickoff session where the activity was to go in small groups, get to know one another, and then find commonalities or similarities. All right, next slide, please. So the final strategy I have for you is making your course inclusive. So the first bullet I have here is expect difference and disruption. We often create trainings for kind of a prototypical learner. And we often create trainings with the expectation, or at least the hope, that everything will go really smoothly and everyone will have the technology that they need. And you know, if you've trained before, then you know this is not always the case, that learning environments are often not ideal. And you probably also know that your learners really vary in terms of their background, their knowledge, skills, their abilities, and needs, including their access needs. So it's really important that we proactively plan for accessibility and build in flexibility, and that we also build in support, especially technical support. So next slide, I'll provide you some examples. All right, so we always aimed to create a very proactive plan for accessibility. So on the right, you can see one of our videos, and we had it professionally closed captioned. And on the left, I've kind of highlighted the course content to show you some of the accessibility and flexibility we tried to build in. We've provided the slides so folks can download those and follow along. We've provided just an audio version if maybe their Wi-Fi connectivity doesn't really allow them to play video or they're commuting in a car. We've also provided transcripts from that mirror the closed captions that they can download as well. And I don't have an image, but we also tried to build in as much flexibility with the assessments as possible so that it didn't get too stale. All right, so let's see, next slide, please. All right, and then the final thing that we did is that we built in support for an improved online learning experience. We really didn't want to assume that all our learners had a lot of experience in an online environment. So the one thing, we provided very clear technology requirements when we advertised the course in order to have kind of an ideal experience. And we were very, very specific in terms of connectivity and browser requirements. We also held a kickoff meeting where we introduced learners to tools in a very playful way. So on the right, we have practice for using polls and reactions. And I led this meeting and I made it kind of silly, and I hope they liked it. We also provided just-in-time support. So if you look at the bottom, it's the same discussion board prompt, but I highlighted in yellow that I actually included instructions for submitting to the discussion board. We use Canvas and not everybody's used it before. And at the bottom, I also linked to Canvas help pages as well. That way folks, if they're doing this at midnight, they can have help at midnight. So next slide, please. So as I wrap up, I would just love to hear from you. And before I turn it over to the next wonderful speaker, I just love to hear, what resonated with you. If there were one or two takeaways that I mentioned, or even if there are a few things that I didn't mention that you might like to talk about more later. I'd love to see that in the chat, just as a way to engage with you and just to make sure, I'm on the mark. So thank you so much. And I'm so pleased to turn this over to Delphina from Heartland to talk about production and implementation. So thank you.
Yes, thank you, Ariel. So before we go into our next presentation, I would like to do a short exercise to help us refocus. It's called Harmony Claps. Next, please.
Today's exercise is going to be a focus exercise, and it's going to help us really clear our brains and get into our bodies. It's called Harmony Claps, and it's actually one of my favorites. So I'm going to give you guys an 8 clap pattern, and I want you to follow along with me. All right, let's do it. Clap once in front of your head, say 1. Once behind your head, say 2. Clap once in front of your chest, say 3. Once behind your back, say 4. Lift up your legs, say 5. In front of your chest, say 6. Other leg, say 7. And in front of your chest, say 8. Let's put it all together now. Clap once in front of your head, say 1. Once behind your head, say 2. Once in front of your chest, say 3. Once behind your back, say 4. Lift up your legs, say 5. In front of your chest, say 6. The other leg, say 7. And in front of your chest, say 8. Wonderful, that's harmony clap. So we're gonna put it all together now. We're gonna go a little faster. Ready, set, go, clap. Once in front of your head, say 1. Once behind your head, say 2. Once in front of your chest, say 3. Once behind your back, say 4. Lift up your leg, say 5. In front of your chest, say 6. The other leg, say 7. And in front of your chest, say 8. Wonderful. And if you guys want to challenge, that was level 1. We're going to do level 2. So we're going even faster without the singing. Ready, and 1, 2, 3, 4, 5, 6, 7, 8. Can you guys go by multiples of 2? Let's try it. And we got 2, 4, 6, 8, 10, 12, 14, 16. Harmony claps, try different multiplications. You guys got this, and thank you for tuning in.
All right, next slide, please. Hi, good afternoon, everyone. I hope you enjoyed that short exercise. My name is Delfina Sanchez. I am the Director of Education at Heartland National TB Center, and I will be talking with you about production and implementation. So up to this point, we have discussed the principles of online learning. In the next few slides, I am going to provide you with 5 steps to develop and implement an effective virtual training plan based on the ADDIE model. Next, please. By the end of this presentation, you will be back 1 slide, please. By the end of this presentation, you'll be able to identify 5 steps to develop an effective virtual training plan based on the ADDIE model. Next slide, please. What exactly is the ADDIE model? ADDIE represents a dynamic, flexible guideline for building any effective training program, and it stands for analysis, design, development, implementation, and evaluation. In the next few slides, we will go through each phase of the model as it applies to producing and implementing virtual training. I will be using our interactive case scenarios for the TB nurse to initiate a contact investigation online course as an example throughout my presentation. Next slide, please. Step 1, analysis. So during the analysis phase, you will analyze your learner needs to understand the learning gaps you need to fill. And this is also where you will develop the course goal. You'll define your target audience, and you will also develop your learning objectives. Course goals are broad general statements of what you want your participants to learn. These are larger, overarching descriptions of outcomes for which verbs like appreciate and understand are appropriate. So when developing the course goal, ask, what exactly would learners be doing if they were demonstrating that they already performed the goal? So an example might look something like this. For participants will understand the TB contact investigation. And it's very broad and general. When defining your target audience, ask, who are your learners? Are they registered nurses and licensed practical vocational nurses? What do your learners already know about the subject? Perhaps they're public health nurses with less than 1 year of TB experience. And as an example off to the right, for this course, we created a self-assessment to get more information about our learners. And this assessment was created in SurveyMonkey. Next slide, please. So when developing learning objectives for your course, you want to ask, what do I want participants to know how to do when they leave this course? Your objectives should be very specific and measurable. And then you should use strong verbs that specifically define participant performance. So I've provided an example from our interactive course below. Upon course completion, participants will be able to discuss initiating a contact investigation, describe the evaluation of contacts, and discuss challenges and approaches in managing and monitoring patients with TB. Again, using strong verbs like discuss and describe. Next slide, please. 2, design. So based on the analysis, you want to make informed decisions to design the best possible learning experience. During the design phase, you will design your assessments to align with your learning objectives. And you want to ask, what kinds of tasks will reveal whether participants have achieved the learning objectives you have identified? And you can do this through evaluations, pre and post tests, quizzes, and role plays. And this is not an exhaustive list. This just gives you a few ideas to get started. Again, off to the right, you can see a few examples. For our interactive case scenarios course, we developed a pre-test as well as an evaluation. And again, these were developed in SurveyMonkey. There is a free version available of SurveyMonkey. It gives you limited features, but it gives you a chance to try it out. And I've provided the link for you below. Next slide. So next, you will choose a course format or delivery system. And this is the medium by which you will deliver the course content to your learners. For our 2-hour interactive case scenarios course, we used Adobe Connect. There are free versions of similar platforms available, such as Zoom, WebEx, MS Teams. For longer courses that include several modules, you may want to consider using an authoring tool and a learning management system, or LMS. An authoring tool is a type of software that allows you to create digital training content, and then you can convert it into an e-learning format and distribute it among your learners via a learning management system or on the web. And a learning management system is software that helps you create, manage, and organize and deliver online training materials to your learners. On the screen, I've provided a few examples of authoring tools that you can use, Adobe Captivate, Camtasia, Lectora Online, and then examples of learning management systems, Adobe Captivate Prime, Canvas, and Moodle. Now, there are also products out there that are both authoring tool and learning management system in one, and examples are Canvas, Google Classroom, and Moodle. Next slide, please. So next, you'll select your instructional strategies. This is where you'll select course content, materials, and activities to guide the facilitation of learning, help your participants satisfy the learning objectives, as well as prepare them for the assessments. And it's important, I just want to note that it is important to match your learning objectives with the activities to ensure that participants satisfy the learning objectives. And on the screen, I've given a few examples of activities that you can use, such as lectures, case studies, group discussions, role plays, breakout rooms, worksheets, brainstorming sessions, as well as video recordings. Next slide, please. So here's an example of learning objective corresponding activities that we used for our interactive case scenarios for the TB Nurse online course. So you can see the objectives to the left, and then the matching activities we selected to the right of the table, and then are some screenshots from this training. Next slide, please. So here I wanted to provide you with a handy infographic from the University of Nebraska Medical Center. This can help you match learning objectives with appropriate activities. And again, this is not an exhaustive list, but it gives you a good place to start. And I've included the link to this product down below. Next slide, please. Step 3, development. So during the development phase, your learning experience to life by your end product and also scheduling a practice run. So first part of the development phase, you will develop or create the course content, materials, and activities. And this can include PowerPoint slides, case studies, breakout rooms, tests, polling questions, and there's more included in this list. Again, this is not an exhaustive list, just gives you some ideas of what you can use. And then following are screenshots of PowerPoint slides, case studies, and then the breakout rooms that we use for interactive case scenarios course. Next slide, please. So now that you've developed your materials, it's time to schedule a run through. And this is a real-time rehearsal of the course using all the materials you created. I want to note it is important when you're doing your run through to provide feedback assessment to find areas that need improvement, time your run through to make sure the course can be completed within the allotted time, and also ensure training platform is working properly, and orient your speakers and learners with the chosen virtual training platform. And then you also want to ensure that you have enough staff on hand to help facilitate your training. Next slide, please. Step 4, implementation. So now that you've gone through a real-time rehearsal and you've worked through any kinks or problems, finally time to distribute your learning end product to learners. Following are screenshots taken from our interactive case scenarios course, online course. And as I mentioned earlier, we chose Adobe Connect as the medium to the course to our participants. The first screenshot shows you the lobby or the main where participants start the course. And then go into our case study, and then breakout rooms, and then debrief with all the participants at the end. Next slide, please. So the step 5, evaluation. So during the final step, during the evaluation phase, evaluate the effectiveness of your learning end product, and then make any necessary updates. Using a course evaluation can help you determine which need improvement. And then from here, you'll loop back to the analysis phase and adjust as needed to improve the course. On the screen, an example of the evaluation we used for the course. Again, this was developed in SurveyMonkey, and I've provided you with the link. Next slide, please. So now I will pass it on to Amelia and Anne. Thank you.
Thank you so much, Delphina. It's my pleasure to be here with you all today. I'm Anne Raftery, a TB nurse consultant and the Associate Medical Director at the Curry International TB Center at UCSF. And with me today is Amelia Alanis, one of our program managers at the Curry Center, and the one who was instrumental in converting our TB case management and contact investigation in-person training to a series of virtual trainings. Together, we'll be sharing a process that we use to bring the in-person learning experience to the virtual environment, focusing on the use of small group facilitators for skill building activities. Next slide. So one of the tools that we've incorporated into our virtual trainings was the 20-20-20 rule. So we'd like to use it now to demonstrate it. So what I'd like you all to do is to look away from your computer screen, focus your sight 20 feet or more away for 20 seconds. So do that now. Feel free to stand or stretch during this time, move your body around. So this is a tool that we try to incorporate every 20 minutes or so during our virtual trainings to help address the computer fatigue that accompanies virtual trainings and meetings. Next slide, please. So we have the third learning objective that we're taking you through. We hope that by the end of our session, you'll be able to describe several considerations for recruiting and preparing facilitators to support skill building activities in the virtual training environment. Now I'll pass over to Amelia and we'll have the next slide, please.
Thank you, Anne. So these are the 4 key points that we hope to share with you today. We'll first discuss facilitator recruitment to support the skill development and the application of information through skill building activities or case studies, depending on the training. We'll discuss the process of preparing materials for facilitators to guide discussion and communicate key concepts. We'll discuss facilitator orientation, both from a technology perspective and a content perspective. And then lastly, we'll also touch on our strategy to match facilitators with learners from their state, region, or jurisdiction. Next slide, please.
One of the challenges that we faced in restructuring our case management and contact investigation training was converting skill building activities, which during the in-person trainings could be oftentimes managed by just one trainer. We accomplished this through recruitment and use of experienced TB program staff from across the U.S., preparing them to facilitate virtual small group activities within the Zoom platform. Our goal was to match learners with facilitators from their same state or their general region to allow those new to the TB program to become familiar with an expert or a go-to person from their state or their region. It also allows for the facilitator to point out any state-specific policies or procedures or maybe forms that learners should be aware of. Once we had the list of applicants who had applied for our virtual training, we tried to secure facilitators from the state or regions where the applicants were based. We weren't always able to do this, but that was our plan and that's what we strove for. Next slide. So these are the faces of many of the talented TB experts that joined us as small group facilitators over this past year and a half. And I noticed that many of you are in the audience, and I know that we are missing a few of the photos of the wonderful facilitators who have joined us. So I just wanted to thank you all. Several of these individuals also served as key presenters for some of the case management and contact investigation modules. Next slide.
Let's see, could we advance a couple? Maybe one more and one more. Great, thank you. So next I wanted to show you all the materials that we created for these trainings. We found a lot of value in creating learner guides or booklets and then facilitator guides to go along with that. This is an example of the first few pages of a learner guide for our TB contact investigation training. We provided a table of contents so that throughout the training, if we asked learners and facilitators to, for example, flip to a flowchart or page X, they had everything on hand and readily accessible. And then we also provided learning objectives and key definitions. Let's go to the next slide. So here are some pages from the facilitator booklet for our interpreting laboratory diagnostic tests training. You'll see that they have the case scenario shown here in blue text, and then the screenshots on these pages, and both of these were provided to the learners, but the facilitators also have discussion points or prompts, answers to the case study questions, and then at the end of each breakout activity, we provided a quote unquote bonus question for groups with extra time. Let's go to the next slide.
Where we were aware of some differences between in the state-specific approaches, we incorporated them into the materials for the learners from that state. So this is a decision tree for when to initiate a TB contact investigation that many of you are familiar with. It's an example of that where we included the California decision tree shown here on the right alongside the CDC version within the learner packet for California learners that were attending the TB contact investigation training. So while we really didn't have many opportunities to do this, this is an area that I think we would continue to try to incorporate where there are, where we know of state-specific ways of showcasing some of the resources. Next slide.
And here, so we have an example of a CI letter. This one is from Orange County, where our faculty speaker was from. And so we found we could share materials from our speaker or facilitator jurisdictions with the learners from that region. We found that if we provided these in PDFs in the booklet, knowing that was where they had the most visibility, they would be accessible there. Then we provided downloadable versions as Word documents on our website so that learners could tailor them to their setting. Next slide, please.
Amelia is going to share a bit about preparing our facilitators for their role, but I'd like to first hear from you all what you think might be some of the biggest needs for preparing our content expert facilitators to support a virtual training. So go ahead and put that into chat. I'd like to see what you all have to say on that. Here we are utilizing some of the adult learning principles, pulling from the expertise of our audience. Waiting for you all to put something into chat. How to engage people virtually. Thank you, Sherry. Yes. The virtual environment is quite different than in person, so that definitely is right on. Zoom skills, yes. The technology platform. Facilitators must realize another level of energy is needed in in-person training. Thank you, Suzanne. Yes. All right. Communication barriers. Yes, how to communicate effectively, especially if people are having problems with audios. Great. Yeah, you all have some great responses and all of these apply. Back to you, Amelia. Next slide.
Great, thank you. Those are all really good and right on target. So a lot of the things that we needed to review in these orientation sessions were technology focused. So for example, how to share screen. If you have two monitors, which share screen goes first, how to troubleshoot audio. A lot of our facilitators had been in Zoom meetings for a year at that point, but many had never actually broken into small rooms yet. So this involved moving them into a small breakout room just to give them a little bit of familiarity with that environment. And then inside the small room, showing them the use of chat, the countdown timer, how to get back to the main room. We really wanted them on the day of the training to feel comfortable themselves and also have the ability to troubleshoot really small learner questions in the moment. So a lot of the things that we wanted to review with them were things that we had thought about ahead of time. And certainly those included the content that we wanted facilitators to know about. But there were those technology focused questions that were things that were somewhat less expected that I've just kind of mentioned. And then also something that was touched on in the chat, definitely how to facilitate virtually, which requires a unique skill set. It's different than being in person. It requires more energy. You have to generate that interaction, right? Even when people don't have their video on, to keep the energy up in the small room. So talking through strategies for that. And we found that we really wanted to meet with facilitators before the training. We were spanning 5 time zones from Hawaii to the East Coast. So maybe it was 1 facilitator orientation, sometimes it was 3, but they were really valuable. Next slide, please.
So this is just an example of some of the feedback that we got from participants, really, especially the virtual trainings where we had these breakout small group sessions for skill building. And, many of them were saying things like that. It was very helpful to have a facilitator from the same state, and that the learners also oftentimes were from the same state. Again, this set of modules, really, we were starting with the beginner sort of entry level learners, those that were within their first year or 2 of doing TB type of service work. So it also gave them an opportunity to connect to somebody who is more senior, more experienced, and maybe somebody working from the same state as them. Some mentioned that there were a lot of materials, so having the learner packets was really helpful, and especially where there might be some unique ways of reflecting the guidelines within the state, that was a bit of a surprise, and it was helpful to have that on hand as well. Some of the challenges that we did encounter, and we also received feedback from our facilitators to help us as we were implementing this early on. Sometimes, though we might anticipate that we've got great matchups between facilitators and learners, the day of training, we may have only about half or 60% of those that were enrolled actually show. So this last minute needing to adjust learner facilitator matches did create some challenges. So we're learning a little bit better each time we run these sessions that have the small group breakouts, how to make adjustments, and also to anticipate that ahead of time to prepare our facilitators should we need to make some adjustments. Next slide.
And so lastly, we just wanted to share some of the lessons that we've learned over the course of the last year. We first learned that virtual training makes the training accessible to many who would not normally be able to attend in person. We've been able to train learners from all 4 COEs, from the Pacific Islands, from everywhere that couldn't normally come to our office, in Berkeley, California. The reason we're doing all this is Anna and I learned through our COVID virtual trainings that you really could mimic that in-person skill building scenario in a virtual environment. Something that we've learned and we're still working through is, the earlier the better. Everyone's very busy. Getting the training on everybody's calendar early, getting those facilitators recruited, securing the time close to the training date for that orientation, really proactively trying to get that on everybody's calendar as early as possible. And then we're holding 6 trainings each twice this year. So we're tweaking the materials between each training just to make sure that it's really focused on the training. It communicates what we want it to communicate. It's easily interpreted by our facilitators. So just ensuring that well-prepared material is accessible to them. And I believe that's our last slide. So next slide, please. And next again. And we'll pass the virtual microphone to Olivia.
Great, thanks, Amelia. And my name is Olivia Dupont, and I am one of the health educators at the Global TB Institute here in Newark, New Jersey. And I'm going to be talking about learner engagement in virtual learning environments. We could easily fill up an entire conference with presentations on this topic. So this will really just be an overview of some of the strategies and lessons learned based on our work here at GTBI and at the other centers of excellence. Next slide, please. So I just want to start with a quick note on burnout. We talk a lot about Zoom and webinar fatigue, and they're really important factors to recognize and take into consideration when you are planning a virtual learning activity. And here at the TB Centers of Excellence, our audience members are primarily frontline workers. So burnout is an especially big consideration. And so it's just really important to be thoughtful about the delivery of your content and the way that you're engaging your learners. It's also really important to be flexible. The virtual learning environment is constantly changing, and learners have a lot of competing responsibilities. So it's going to make a big difference in your learner engagement if you're willing to be adaptable and flexible with your learners as you go. Next slide, please. So Ariel has given us an overview of what synchronous, asynchronous, and hybrid learning formats are. So I just wanted to add a note here to remember that one size does not fit all when it comes to designing a learning activity. So when you're trying to select a format that's going to be the most engaging for your audience, a few things to take into consideration include the amount of content you're delivering, the type of content, whether it's skill building or if it's more largely didactic, how experienced your learners already are and how much kind of extra support they're going to need along the way, the audience availability, time zones. And there's definitely lots of other factors to consider as well, so please feel free to put them in the chat box. And engagement strategies and tools are going to be a little bit different between these different formats, and we'll talk a little bit about that more later. Next slide, please. So first, let's talk about setting up your learning activity for success in terms of learner engagement. So when you're transitioning content to a virtual platform, it's really important to evaluate the quantity of your content, and this goes back a bit to burnout. So if there's an overwhelming amount of information, the audience is just not going to engage with you or with the content as much as you would like. So important to remember, 1 hour of in-person instruction does not effectively translate to 1 hour of virtual instruction. And I was actually reading this great article about some research being done at Stanford, talking about the ways that Zoom and webinar platforms can be really psychologically intense and exhausting. And virtual meetings require a lot more mental work than meetings in person because of all the kind of extra effort we have to put into communicate, interpret actions, and to stay focused when we're not physically in a space together. So it's really important to kind of reevaluate the information you want to provide, decide what the most important takeaways are, and then try and cut out all of the fluff. Also, you want to limit your didactic content, and we usually recommend sticking to kind of 15 to 20-minute chunks. So for pre-recorded lectures or videos, try and keep them around that length. During synchronous sessions, try and take a pause every 20 minutes or so to kind of check in, see if there's questions, or engage in some sort of activity to break up the content like you've seen during this session. And then finally, prioritizing discussion-based learning, really important for engagement. And this is where it's going to be important, again, to cut down on the quantity of your content so that you can really use that live time for engaging directly with your audience and hearing from them. And you can even get the learners involved in kind of leading the live session. So you could have them present case scenarios or assign someone to be the lead of their breakout room. So just really try and take advantage of that live time together to have discussion. Next slide, please. So here are a few tools for engaging your audience during synchronous sessions like this one, and you're probably already familiar with a lot of these. So of course, first you're going to need a virtual platform, and they're not all the same. The tools and capabilities are going to be a little bit different depending on the platform you use. So just do some research into what you have access to and what the capabilities are so you know what will work best for your audience and for engagement activities. So we have polling, which is of course a great tool for larger audiences. And it might be good for groups that are a little bit shyer as well. Or if you're having trouble kind of getting folks to engage through verbal discussion, think about adding in some polling questions to kind of warm everybody up. You have the chat box, another great way to get the audience involved like we've seen today. But you do want to kind of consider your group and what kinds of questions you're asking. If you're asking a question where there's a right or a wrong answer, people may be a little bit less eager to add something that's potentially incorrect to the chat. And then we have annotation tools, which are great for small groups, and you can share a file or a document, and everyone can kind of write and contribute to it together from their computer. And then breakout rooms, which we've touched on throughout this presentation, which are really great for small groups and skill-building exercises. And people tend to be a little bit more vocal in small groups than large sessions, so it's another good option for kind of warming up a group. So I would choose one or two of these to kind of incorporate into a live training. You don't want to do all of them at once. You really want to kind of maintain a balance in the number of engagement activities you're doing. And there's definitely lots of other tools out there. We don't have time to cover them all. But if you have others that you like or you've used, please feel free to throw those into the chat box. Next slide, please. So we're going to take a quick pause and do a polling question. So please let me know, do you usually multitask when you're attending a meeting online? And you can be honest, this is an anonymous poll. We'll leave this up here for a few seconds, but your options are, yes, I'm multitasking right now. You know, sometimes, maybe no, but my mind does tend to kind of wander off, or no, I am 100% focused all the time. And I'll give this a couple seconds, or Tony, feel free to pull it down if responses start to slow down a bit. Okay, maybe we can go ahead and close that up and share the responses. Okay, yeah, so we have some mixed results here, and I like the honesty. Yeah, so, you know, the truth is we all multitask sometimes, or our mind kind of starts to drift off. And I think these responses kind of highlight the importance of engaging your learners during virtual learning activities, doing periodic check-ins like this one. You know, it's so easy to become distracted or to get pulled into multiple activities at the same time. So just use quick tools like polling questions to kind of bring everybody back to the session. Okay, next slide, please. Okay, so let's just talk quickly about some tools for engagement during asynchronous or hybrid learning activities. So to start off with, as opposed to just kind of emailing resources or activities out to your learners, you might want to really consider using a learning management system. I know we've talked about a couple throughout this session. And your learning management system would really be the home for your course, where you can kind of post all of your content and activities. So we use Canvas here at the Global TV Institute, and we really do use our LMS for everything. So we will place all of our materials, our resources, and our instructions on there. And that becomes a place your learner can kind of always refer back to. And again, all LMS systems are not the same, so just do some research into different platforms and what you might have access to at your organization. And then we have pre-recorded lectures, which are, again, a really great tool for asynchronous instruction. Again, I would try and keep them to about 20 minutes in length or so. And there's lots of tools out there that can kind of help you build in interactive elements into your lectures. So we use a tool here called PlayPosit, where we can kind of add in engagement elements like quiz questions. And there's lots of tools out there that will also let you set up your videos so that they can't be skipped, or they can't be fast forwarded through, or so that, you know, they'll pause if the learner enters another tab. So there's lots of cool customizable options out there for pre-recorded lectures. And then self-paced exercises, we talked about quite a few today, like quizzes or readings or case reviews. And then finally, discussion forums, where you can kind of create a space where your participants can interact on their own time. So you can pose questions or scenarios and have participants join in as part of their self-paced work. And so just a note, like the tools that we talked about before for live sessions, try to pick a few of these to use, but not too many. And it's nice to kind of keep things simple and consistent for your learners. And of course, please feel free to pop in any other asynchronous tools that you like using in the chat box. Next slide, please. Okay, so I just want to talk for a moment about creating a virtual community, which is a really important part of engaging learners, even if it's just a 1-hour session. So when you're trying to get learners to engage with each other, sometimes it's nice to just have them introduce themselves. We talked about this a little bit today as well. For a small group, you could just go around and ask everyone to turn on their camera and say hello, or you can use discussion forums or use the chat box like we did today. And for audience engagement, I think it's really important to lead by example. So, you know, if you're a facilitator and you are asking everybody to use the chat box, like, you should be using the chat box too. And if you're having a session and you want everyone to have their cameras on, you should have you and your team should have their cameras on too. So the engagement really starts with you. So I just think that's something really important as you go through a training. And you can also build in opportunities for greater engagement between the learners and instructors. So virtual office hours are an option. You could have you could have your instructors be available for some additional time to answer questions outside of the larger group. Facilitators or coordinators could have office hours as well, where they can kind of help with technical or logistical questions. Depending on your instructor availability, you could also have informal extended Q&As, which we've done for some trainings, where you can offer for folks to stay on after the live session has kind of formally ended, and you can dive into additional questions. And then this has been mentioned as well, but it's important to know who is in your training. So just really take the time to look at your registration, see who's going to be joining, so that you can engage with them better. Next slide, please. Okay, and so let's talk about keeping your participants on track, which is very important because they cannot fully engage in your activity if they're not clear on what is going on. So first off, for expectations, you just want to make the expectations for your course or training very clear from the beginning. So what is the time commitment? What is the format? Are they going to need to download something? Are they going to be expected to be on camera? Just make sure those expectations are laid out clearly so that you don't have folks dropping off or kind of asking what's going to be expected. For instructions, it's very important when working in a virtual platform that everybody knows how to connect and what to do. So send out clear instructions to everyone in your group or your cohort. Use bold, highlighted, colored text to kind of let people know where's the password, what link should you be using. You can always share webinar video tutorials or tutorials for your LMS. You know, there's hundreds of Zoom videos out on YouTube that you could pull from if you needed to use them. And then just reminders. People really do need reminders. I definitely need reminders. And if someone signed up for your learning activity, they probably really want to be there. So schedule some reminders to be sent out. I usually send one out the week before and then the day of an activity. And you can just pre-schedule those as well so you don't have to worry about them. Yeah, so just use some of these to kind of set your participants up for successful engagement in your course. Next slide, please. So assessments and feedback have been touched on a little bit, but I just wanted to add a note that, you know, every single group of learners is going to be a little bit different, and the level of engagement is going to be a little different with each group. So sometimes it's not quite so intuitive as to what might need to be adjusted to increase engagement. So you can always just ask. You can add questions about engagement to a formal assessment, or you could have just some sort of quick polling question at the end of a live session and say like, hey, was there enough time for Q&A today? Or like, hey, would you guys be interested in having office hours? So just be really flexible and open to adjusting your training as you go. Okay, next slide, please. And then I just want to wrap up with talking about motivating participants, first to join your training and then to kind of stick with it as you go. And so, you know, you can always offer continuing education credits, which are, you know, sometimes contingent on a level of participation. You could offer certificates of participation, and then you could offer kind of badges or awards for people participating. And some learning platforms and a lot of conference platforms now have kind of a leaderboards that show who's participating the most, and they get awards, and you can offer prizes or gift cards for the winners. So these are just some kind of additional ways that you can help your engagement. Okay, next slide, please. Okay, so that was just like a whirlwind tour of some of the ways that we have learned to enhance learner engagement. It's definitely not all of the ways, and of course, we'd love to hear any additional thoughts or comments in the chat box as well. But I hope that there were maybe a couple tools or tips that you can kind of take away. And I just want to end with these big 3 themes for virtual engagement. So the first one is just one size does not fit all. There's really not one correct way or one way to engage virtual learners, but you should really just learn about the tools and strategies that you have access to, and then just tailor each of your learning experiences to the audience. And then we have balance. So an effective and an engaging learning environment is really going to have kind of a balance in the amounts of content and in the ways that you're engaging your learners. So you don't want it to be too much and be overwhelming, but you don't want it to be too little either. And then just flexibility. Just be flexible with your learners. We're all kind of getting adjusted to this virtual world, and it's changing constantly. And so just be open to kind of changing things around as you go and being open to feedback. And I just want to say also, please feel free to reach out to your TD Centers of Excellence if you want more information or if you want some sort of support in planning TB education and training activities. And that is all I have for now. And of course, I'd be happy to answer any questions as well. Thank you.
Thank you to our speakers for their presentations. We will conclude today's webinar with a question and answer session. Thank you to those for submitting questions using the Zoom's Q&A box. Feel free to submit additional questions through the Q&A box or through the chat box. So we did have one question come in that says, how do you do virtual role-playing for participants or teach-back activities? And Anne, would you like to answer this one?
Sure, I'll get it started, and other presenters may want to add as well their thoughts. I think that the virtual platform that we've been using for our trainings, and others probably are equally good for doing role playing, as well as teach back, although I haven't tried the teach back as much through the virtual platform. But I think the key is really the important aspect is ensuring that your materials are very well described, so that if you would like to have a role play practice in small breakout groups, you can have it be self-directed role play, which would mimic in-person practice of having like the learners broken out into, say, triads, where you have one person playing the role of maybe a patient, one playing the role of the healthcare worker, and then one's an observer, and then they rotate roles. So the key really, I think, is in your material preparation to help that be a self-directed activity, and then also in setting up the activity, so giving very clear instructions. These are all things I think that we do in our in-person trainings, and they're best practices for that can transfer to the virtual environment. For teach back, however, I think and maybe in some instances for role playing where you're trying to do some skill building, but also provide feedback. And we do this in the Virtual Training Academy trainings for COVID in California, where learners are broken out into small groups, maybe a size of 6 or so, 6 to 8 learners. And then they practice delivering a script. So somebody's playing the role of the person who tested positive for COVID-19, another person's playing the case investigator who's reaching out to them, and practicing that interview, and then getting some feedback at the end of it to help with building on areas where they could make improvements. So I think for teach back activities, you could do the same kind of thing where you would have an experienced facilitator in each one of those breakout groups. And that's similar to how we're using the facilitators in our skill building breakout groups for the trainings where we have that. Maybe others have other thoughts on that question?
I'd only just reiterate the assigning roles if you're doing role-playing activity, and one, in our COVID trainings would be the case investigator, one would be the person who tested positive for COVID, and then the others, and you tell them before the activity begins, everyone else's feedback. So we'll go around the circle after, and everyone will give, a piece of constructive criticism or something they thought went well throughout the training. So really incorporating everyone into the activity. Otherwise, it's quite easy to space out behind your camera with your camera off in these, breakout rooms.
Thank you, Amelia and Anne. We also had one question come in. Can you please elaborate on the use of annotation tools that can be used collaboratively during online events? Olivia, is there anything that comes to mind?
Yeah, so I think the most common one that's used is probably just the annotation tool in Zoom. It does tend to be a little bit better for kind of smaller groups, so you don't have too much going on. But there are some other platforms out there. I think some were mentioned in the chat as well, like Whiteboard, Kahoot. It doesn't necessarily add onto a document, but you can have people send in words, or Mentimeter. I don't know if others on the call have used other annotation tools as well. I think we've mostly used the Zoom version as of now.
Yeah, I can say that for Heartland's Interactive Case Scenarios course, which was in Adobe Connect, we relied on Board in the chat box.
And within the chat box of this webinar, we also have attached a resource list of some resources that the speakers have compiled, so that resource list might have some options available as well. If anyone would like to ask their question over the phone, feel free to raise your hand and we will make sure that you're unmuted. Now we have another question. Do you know of any public health eSIMs?
I'm not sure what's meant by that. Virtual simulations, is that like for health, Shelby? Yeah, that one might just need a little bit more explanation or clarification of the question.
We can move on to the next question. What would you suggest being the best method to encourage networking once the virtual training has ended? I have found that to be a valuable tool of in-person trainings and can't visualize how to incorporate that in virtual learnings.
I could speak a little bit to that. But more as a participant, I've attended a number of online trainings, and what they really did is they built these into the schedule. And they were certainly optional, but they didn't present them as optional. And so there were breakout sessions, and we could choose them based on interests. There were a few different platforms that we used. They were all kind of experimental, that were kind of complicated, and there was a lot of tech support needed. But even if you're using something like Zoom, you can have folks move to different breakout sessions based on they can select or join. And that was just a great way for us. We just kind of aligned around our interests. And I think they gave us talking points that they wanted us to do. And so that was just kind of a nice way to encourage us to connect or chat. But I'd love to hear from other folks.
I was thinking oh, go ahead.
Sorry, Anne. Yeah, I was going to say, I've definitely seen that on some conference platforms. I know one platform I've attended on was, I think it's called Hubilo. Hopefully I'm not mispronouncing that. And there was kind of networking options after the formal presentations have ended, and you could kind of see who was at different tables, which were essentially breakout rooms, and you could kind of click in and join depending on topics and where you were joining from. I know sometimes it is really challenging with live sessions, especially shorter sessions, to fit in that networking time. I know some trainings have done kind of virtual networking lunches, although of course you do want to include time for people to kind of step away from their computers as well. So, leaving those optional. And then I just wanted to add a note that for kind of asynchronous or hybrid courses, if you do use a discussion forum, we do leave our LMS open for a couple weeks after the course has ended. And sometimes participants continue to kind of chat back and forth on their, introductory discussion forum about, where they're working from or joining from, or kind of what health department they're at. So there's some options for kind of more asynchronous networking to continue on. Sorry, Anne, I'll pass it over to you.
Yeah, no problem. Thank you, Olivia. Yeah, I was just going to add post-virtual training. We have also encouraged learners within their groups, since we're in some of our case management trainings, we're trying to match learners within the same state or within the same region. So we've encouraged them to share their email address or contact information if they so choose. That way they're able to network after the training as well. So, and then I saw that Lisa, Dr. Chen has also put into the chat that she's encouraged learners to use WhatsApp groups to stay connected during and after courses. And we've done that in some of our global training. So again, it's thinking about it ahead of time about the potential opportunity, and then planning to incorporate that opportunity and extend that opportunity during the time of the virtual training.
Thank you. Circling back to the question about VSIMs, that does stand for Interactive Virtual Simulations. So does anyone know of any public health virtual simulations? I see in the chat someone mentioned Second Life. Thank you.
I don't have any experience with that.
Thank you. We're coming up on time. We have about 4 more minutes left. We have an additional question. Are there examples of icebreakers that work really well for kicking off virtual trainings?
So one that we tried, it was just so simple, was we put folks in groups and we just asked them to find 5 similarities. And some groups found 5 professional similarities, some found personal similarities, but the groups really just decided what they were going to do. And then they introduced each other, and they really seemed to enjoy it. So keeping it very simple, I think, is the secret.
Yeah, I would agree. And also, I think it depends on the size of the group. So in a smaller group, say maybe you've got 20 to 25 learners, maybe breaking them into smaller groups to have like a pointed question that they're sharing with each other, or breaking them into pairs or triads, that can work. But if you've got like a very large group of, say, 150 learners, sometimes just a really quick, simple, answer to a question like, what's your favorite dessert, or what's your favorite eating spot in such and such a location, or where would you like to take a vacation, during the time of our shelter in place. That was a common one that we used, I think, in our COVID trainings, was just kind of dreaming about being elsewhere other than our homes. So I think it kind of depends on the size of the group.
If you can make those groups small, I think that's a recipe for success. I will, if there's 50 or 100 people, I'm not going to unmute myself. I'd be too embarrassed. So there's 5, I will happily do it.
Yeah, and Ariel, going off of that, I think every group is just so different. And some, we have our TV intensive course. We always have about 25 people. And some groups are, more talkative than others. And so I think sometimes you might have to start with something more like polling, and then kind of build into like open discussion or small groups. So I think being like really flexible, and maybe even having like a plan B if people are being really quiet. And also it's great if the facilitators and the instructors can kind of start off the group and like lead by example and do an introduction first to kind of get everybody going.
Thank you. And we are coming right up at time. I think we've addressed all of the questions submitted. So thank you to our speakers and participants for joining today's call. While if we could not answer all of the questions submitted through the registration form or the chat box, we will be able to use this information to inform future webinar topics. Thank you again, and I hope everyone has a great rest of your day. Thank you.
Thanks for joining, everyone.